If you're one of the millions of people struggling with depression, you know it's more than just feeling sad. Depression can make everyday life feel heavy. You might notice low mood, loss of interest in things you used to enjoy, trouble concentrating, changes in sleep or appetite, and a feeling of being disconnected from the people around you. Even just getting out of bed can feel like climbing a mountain. Depression affects your entire life: work, school, relationships, even your sense of self and hope. Depression quietly chips away at your energy, your motivation, and your joy until you feel helpless and hopeless. But what if there was a way to begin feeling like yourself again? Symptoms of depression, or MDD, include depressed mood, including feelings of sadness, emptiness, or hopelessness, loss of interest or pleasure in most or all normal activities, changes in appetite and or weight, sleep disturbances including insomnia or excessive sleeping, fatigue, tiredness, and lack of energy, trouble thinking, concentrating, and making decisions, and frequent and recurrent thoughts of death and suicidal ideation. If these symptoms sound familiar, you are not alone. For many, finding the right support and treatment can mean finding your way back to yourself, rediscovering laughter, connection, and hope in the process. That's where Prozac, also known as fluoxetine, comes in. Prozac is a selective serotonin reuptake inhibitor, or SSRI. It works by helping restore balance to serotonin, one of the brain's chemicals responsible for mood, energy, and emotional stability. When serotonin levels are imbalanced, depression can feel overwhelming. Prozac helps regulate that system over time so daily life feels more manageable. Depression affects millions of people every year. In fact, about 21 million adults and 17% of adolescents in the United States experience a major depressive episode annually. In clinical trials, around 61% of adolescents showed significant improvement on Prozac alone within just 12 weeks, increasing to 71% when Prozac was combined with therapy. Wondering if Prozac is right for you? Ask one of the 92% of adults who reported meaningful improvement in psychological distress while taking Prozac. So, what can Prozac do for you? Let's take a look. Prozac can help improve overall mood and emotional balance, making it easier to face everyday tasks. Prozac can also help increase energy and motivation and restore interest in hobbies, activities, and relationships. Prozac also supports clearer thinking and improved concentration. Let Prozac help you restore a greater sense of hope, confidence, and quality of life. Prozac is FDA approved to treat major depressive disorder in both teens and adults, starting at adolescents ages 12 and older, making it one of the few antidepressants with pediatric FDA approval for depression. Ask your provider about how Prozac can help you today. Providers work collaboratively with patients, families, and faith leaders to support the best treatment decisions for you. Prozac can be combined with spiritual or cultural healing practices to honor personal beliefs while ensuring safety and well-being. Working with a provider who respects your beliefs can help you find a plan that honors both your health and your spiritual cultural identity. Side effects may include nausea, sleep changes, headache, anxiety, or upset stomach. Some people may experience changes in appetite or weight. Always talk to your provider about risks, especially if you have a history of bipolar disorder or are taking other medications. Seek immediate medical help if you're experiencing worsening mood, suicidal thoughts, or unusual behavior changes before starting Prozac. If you're struggling with depression, talk to your healthcare provider about whether Prozac might be right for you. You deserve to feel hopeful. You deserve to enjoy life again. Ask your doctor about Prozac, because your story isn't over and hope is closer than you think.